Are you on testosterone replacement therapy and concerned or worried about diabetes? Well, your blood sugar tests that you're using may actually be fooling you or be skewed. Today, we're diving into the hidden connection between TRT, blood donations, and your A1C blood test. And it's a connection that maybe even your doctor has missed. This is critical information if you're on TRT and being careful in monitoring your blood sugar values. Hello and welcome. My name is Dr. Terranella, and this channel is dedicated to helping you optimize and improve your health. Today, we're looking at how TRT can impact your diabetes test results. We'll draw on over my 15 years of clinical experience, plus some research on this topic to help us answer the question. If you're finding this information useful and helpful, click on the like and subscribe to continue getting these videos. So TRT can boost your red blood cell count, and that's called erythrocytosis, and some people refer to it as polycythemia. And many guys that are on TRT are going to donate blood to manage this problem. That seems pretty simple, right? Wrong, because this can seriously skew your A1C test results, giving you a falsely low reading. And we need an accurate A1C reading. A falsely low A1C can make you think that your blood sugar is good and you can just go crazy eating all the carbs you want. And that can lead to problems down the road like heart disease and diabetes and more severe diabetes and blood sugar problems. So we need the real actual picture of what's going on inside your body. That's what these tests are for. Imagine looking at your speedometer when you're driving down the road. It says 60 when in reality it's actually 90 or 100. That's what a false A1C reading can be like for someone with diabetes and really for everyone that's trying to optimize their health. So the mistake that people often make is just assuming that their A1C blood test is accurate and that there's really no impact when they're donating blood. And many doctors don't fully understand the implications and interactions between testosterone replacement therapy, blood donations, that whole interaction with the A1C and the management of your diabetes and blood sugar problem. And so let's break this down a little bit more so you can clearly understand how these two things are connected. So your A1C measures the percentage of your hemoglobin, which is part of a red blood cell that is coated in sugar, and that process is called glycation. And it reflects the average blood sugar over the course of 3, maybe 4 months. It's the average lifespan of those red blood cells. Testosterone replacement therapy, or TRT, increases the stimulation to the bone marrow via erythropoietin to produce more red blood cells. And that's the erythrocytosis. And this can lead to much thicker blood, increasing the risk of blood clot. And so what we do is have you go donate blood to manage the increased hematocrit, increased red blood cells, increased platelets. And that's the key. When you donate the blood, you're donating those old cells, the ones that have been exposed to the glucose for longer periods of time. And that's the key marker of the A1C test that we're trying to identify. This leaves a higher proportion of the younger, newer, fresher red blood cells present in the sample. And so they haven't been exposed to the glycation process as long, and this artificially lowers the A1C value. So this is primarily an issue for those men that are on TRT and have this problem with increased red blood cells or erythrocytosis, and also who donate blood regularly. It's not necessarily just a problem for people that have diabetes or blood sugar problems, although those people want to be even more cautious about this test. And the connection between those are a lot of times the people that have higher hematocrit and erythrocytosis also have the blood sugar issues. And the interplay between these three seemingly unrelated things, the testosterone replacement therapy, erythrocytosis or increased red blood cells, and blood donations and A1C, are a good example of how seemingly unrelated things are actually having a great impact on your health markers and how you read and interpret your results. And so if you're in this situation, what are you actually going to do to solve the problem, or how are you going to get an accurate reading? Well, you can't just stop donating blood. Well, you could, but then that could be dangerous for increased blood clots. So what are you going to do? Well, it's important to make sure your doctor is clued into this. As I said, a lot of times doctors are not clued into this fact. And it's something that I came across as I was doing more research on hemoglobin A1C tests, and I made the connection with testosterone replacement therapy. And so you want to get your doctor involved and be specific about the frequency of your blood donations and also how that timing-wise is connecting with when you're going in for your A1C test. If you have a full 4 months of no donations, then I think you're getting a fairly accurate reading of your A1C. And so it may be helpful, if possible, for you to go a full 4 months to get the A1C test and then do your blood donation. But it needs to be carefully balanced with the amount of erythrocytosis that's going on. Some people need to donate blood every 2 months. And so it definitely requires some careful monitoring and tweaking of what your options are. Alternatively, you could do a fructosamine test. This is a shorter period of time, so it's averaging the last 2 or 3 weeks, and it doesn't really rely on hemoglobin, so it's not going to be affected at all or as much by blood donations. Another option is to just get a continuous glucose monitor that sticks in your arm, and it's giving you readings all the time, every single day. At the end of 90 days, you can get an estimated average glucose from that, which is probably going to be a little bit more accurate than the A1C anyways. Of course, you can do the old-fashioned finger sticks and get a feel for what's going on with your blood sugar that way as well. So before we jump into the key takeaways, I did want to point out that I do have a new ebook that I've created called Mastering Your TRT, and it's a guide to helping you thrive on testosterone replacement therapy. I'll put a link to that in the description. So here's some key takeaways to keep in mind. Testosterone replacement therapy leads to increased red blood cell production called erythrocytosis. And one way that we manage that increased red blood cell production is with blood donations. When you do that, it can falsely lower your A1C levels because you're getting rid of those older red blood cells. And this can mask or suggest that you have great blood sugar when in fact you actually don't. If your doctor is not aware of your blood donation schedule, make sure they're aware. And you might also want to clue them into the fact that this may affect your hemoglobin A1C tests. We can also, of course, consider other tests like the fructosamine or CGM to get a more accurate number, especially when you're needing to donate every 2 months or 3 months in order to keep those red blood cells in check. So I guess the big key takeaway is to not assume that your lab tests are telling you the full story and be proactive person with your health and what's going on with your body. Definitely want to loop your doctor in and make sure they're informed on what's going on in terms of your blood donations and some of the things that you're finding. Hopefully this video gives you a better understanding of the impact of TRT on diabetes tests. If you do have questions, definitely drop them in the comment section. If you want a more nuanced answer, consider joining the members for more direct access to me. You'll also be supporting the work that I do in this channel. Now, one question you might have after looking at this video is, what are the other things that can affect my A1C tests? And you can find more information on that in this video right here.